The LPN has attended staff education program on delegation. Okay. Which of the following the LPN knows is not one of the right of delegation? Think about it. Which of this one you know that is not one of the delegation? So what you need to do, read it from the back. Which of the following the LPN knows is not one of the what? The right of delegation. The LPN attended the program on delegation. So which one knows is not one of the right? The right of delegation, you know, the right tax, right situation, right person, all these things is right. Medication, all of them is associated with delegation. A nurse can delegate a certain task to LPN. It can also delegate, but at the same time supervise. And then it has to be right supervision, right direction, but accountability of what happened. If the job was done or not is on the nurse. She cannot delegate that task to the accountability for that task that is being given always fall on the nurse. It can provide supervision, it can provide direction, it can provide tasks, but it will never, never, never delegate the accountability. So 2 is the right answer. And then number 2, which prescription the LPN should anticipate in the plan of care to decrease vaso-occlusive event and reduce hospitalization? A bunch of words. When you see this, if you're going to take your test and your LPN, don't freak out. Just relax, right? Break it down. Look for the buzzword. A nurse and the LPN provide care for a client with what? Sickle cell disease. Number 1 point. Which prescription, okay, the LPN should anticipate in the plan of care to decrease what? Vaso-occlusive event and reduce hospitalization. Patient is in the hospital because something happened. Now we want to stop that thing from happening, prevent the patient from coming to the hospital. What medication do you think they're going to take? Test taking strategy. Whatever they've been taking, it's fine. But there's one thing when you have a medical problem, we give it to you to prevent you from coming to the hospital. We call it maintenance medication. So maintenance medication is what you need. That will prevent you from having vaso-occlusive event and reduces hospitalization. Acetaminophen is not enough for them. They need what? Morphine or narcotic. But this morphine or narcotic is for acute problem. Vaso-occlusive disease. We're talking about what? Decreasing the incidence. We don't want you to have it. Isotonic infusion is the same thing. It's used to treat vaso-occlusive disease, but it's not used to prevent them from coming. Therefore, hydroxyurea. You see test taking strategy. There's medication for acute problem, medication for maintenance. The question is asking you for maintenance. How do I know? Because I break down the question. That's the way you should proceed. Number 3, another long question. I intentionally said these long questions for the LPN so that you can develop these skills. Which action is appropriate, right? I have underlined one thing. The LPN noted a fetal bradycardia as soon as maternal contraction begins and disappears as soon as the contraction ceased when observing a 37-year-old client in a client at 37 weeks of gestation in active labor. If you look at it, mommy contract, it come down. Mommy contract and come down. You look at the fetal heart rate, they said as soon as contraction begin, baby heart rate come down. When a mommy finished, baby heart rate come back. The same thing, contraction start, baby heart rate come down and come back. This is what we call early deceleration. It's bradycardia, but it's early deceleration. It's not a bad thing. You just have to check for progression of labor. You don't place the client on the left side. It's not placenta insufficiency. You don't place the client on knee to chest position. It's not prolapse. Of course, oxygen is good, but it never answered the question. Monitor labor progression is the key. This is a hard question. If you get it, you master OB. If you need help, check Adapting Class on YouTube and subscribe and get more content like that. And next, provide care for a client with what? Wilms tumor. Like I said, this content is for LPN and RN. It does not matter, but the same content. Which intervention is appropriate? One word, Wilms tumor. What is that? It's on top of the kidney, right? It's finding young kids. It's part of the kidney. So like the kidney problem, you see it in kids in near the adrenal gland area, and these can secrete methanephron, like it looked like a aldosterone problem or Crohn's disease, basically. And the problem is it increase your production of things that will increase your blood pressure, hypertension. It's like a pheochromocytoma. All these things, they all related, like pheochromocytoma. That's what in a tumor. And it's sick, he has the same signs and symptoms. It's more like pheochromocytoma than Crohn's disease. So that's what you're going to see, hypertension problem. And therefore, what do? This is a traffic question. I put cardiac there. You think you pick it. I put airway. Everybody like airway. Well, it's a tumor that will increase your blood pressure. So we should monitor that one. Number 3. And the last one, which the nurse provide care to a client admitted with anorexia nervosa, which prescription the nurse should prioritize? Prioritization, right? 101. Which one is very important? Keyword, anorexia nervosa. What is their problem? Electrolyte problem. What? Their potassium problem, they have magnesium problem, they have phosphorus problem. All these are low when they come in. Want to make sure they are normal. What is your priority? Mental health consult? Yeah, we know it's a mental health problem, but it's not a priority. Physical need, number 1. Nutrition consult. Yeah, food, fine. Physical need, right? We'll give you nutrition, but is that more important than blood count? Where they have no blood count issue, they have no infection. You should be getting BMP to check for this electrolyte. But the number 1 thing you should do, EKG, because all these things affect your heart. Therefore, get the EKG. This is our Dr. Class. Thank you for watching. Subscribe to my channel for more content like that.